I'm here with Dr. Ralph Poppenbeek, occupational physician, and we're talking about a number of issues pertaining to case management. And at the moment, of course, we are in this era of COVID-19 where pretty much the entire Australian population has undergone enormous change. We're all struggling through doing things completely differently, often doing things from home, homeschooling, new technology, trying to juggle things as best as we can in this current environment. And while most of our fireside chats are about case management kinds of issues, we thought that it would be really great for you, Dr. Poppenbeek, to have a chat to our case management and lawyer, paralegal clients, just to give a few tips around personal resilience and staying strong and mentally tough in this current era of change. So Dr. Poppenbeek, I just wanted to ask you, obviously we are going through an enormous change and this can affect people's resilience. What words of advice could you give as an occupational physician around how to stay strong and how to stay healthy in these times?
Well, firstly, I think there's an interesting correlation between resilience we're talking about in these difficult circumstances and the resilience we expect of patients in their difficult circumstances in dealing with a work injury. Now, in the latter group of patients, the amount of resilience varies enormously. And my observation is that the degree of resilience determines whether or not the outcome is going to be positive. The same applies to us in this circumstance. It's been difficult for all of us. I had a lot of troubles at the start. I felt terribly anxious, partly because I'm in one of the vulnerable age groups, without mentioning any numbers. And I think the main fears you have are, first of all, am I going to get the infection? And if I do, am I going to die or have to go to intensive care or whatever? That's the most important thing because we're talking about life and death. And secondly, how do I maintain my normal life with all of these restrictions? And thirdly, how do I maintain work? Now, the second two things are not that difficult to answer because what we need to do is what we're doing now, doing video conferencing, which for someone of my generation is a bit of a jump into the unknown. But nonetheless, with the help of MEDirect, I'm finding it fairly easy. But things like whether you get the infection or not. Now, preventing that is fairly simple. You do the distancing and the things that the government have recommended, which I think is very worthwhile. And you wear gloves because that's one means of the thing being transmitted. Take them off, make sure you wash your hands, wear a mask if you need to. In those methods, you can actually reduce your risk pretty substantially. And the other thing you've got to remember is we're pretty fortunate in Victoria because we have a very low incidence of coronavirus.
Very well.
Sorry?
We're doing very well, and nationally, the last week has brought some really good news.
Yeah, and Australia is certainly turning out to be the lucky country here, I think. So I think that issue is one that we can deal with, but in order to deal with it, there are a lot of changes. Now, in order to build your resilience to all of this sort of stuff, you're just going to be focused on what's important to you. At my stage of life, being focused on getting the infection or not's a pretty important issue, but I'm not overly fussed by that. I think you've also got to rely on what your other abilities are and what your interests are. You might enjoy cooking, which is a very useful thing to do. I certainly do. You might play a musical instrument. You might enjoy reading. You've got to think about the things you enjoy doing. And you may not have had much time to indulge in them before, and now you've got the opportunity to do it, but that's only part of the problem. You've also got to apply yourself to doing these kinds of things, and that's what I find is difficult. I have a lot of interests outside of medicine, but to kind of motivate myself to do them is not that easy. You've really got to put a lot of effort into it.
It's true. I mean, they talk about the analogy of, if the plane's going down, you need to put the oxygen mask on yourself first before other people. And often when we end up in these unusual circumstances, we tend to look after other people and not ourselves. And that is really, I guess, counterproductive. You've talked a lot about making time and making it a priority to still maintain things that, I guess, fill your tank and enable you to keep going, to keep being strong for other people as well. And that's often the thing that we forego when we're feeling challenged and stressed. We look after everybody else and we drop the things that replenish our resources as well. So, you know, you mentioned cooking and playing instruments and doing hobbies, and, you know, as I guess a busy case manager who's now undergoing completely new circumstances, you know, looking after yourself is a priority.
Yeah, yeah, very much so. And it's interesting, you've got to be a bit creative. One of the car clubs I belong to have set up the system of getting people to shoot some videos of their cars and pass them around, because we can't drive them anymore. And that's an interesting, you know, it struck me as being a nice bit of lateral thinking. And you do that on a lot of stuff, you know. But you got to get involved in things that absorb, you know, that hold your interest.
Yeah.
I love detective
things
novels.
you have a purpose, things that give you a sense of purpose. They often talk about with resilience, don't they?
And they make you feel, yeah, and they make you feel good. Unfortunately, with somebody of my build, that tends to revolve around eating chocolate and pastries and, you know, the major food groups.
Nothing wrong with that.
Oh, no. Unfortunately, you see the results. But you've got to try and resist the temptation to do destructive things, which I think for a lot of people become more obvious. You know, like, things are difficult, so I'm going to do what gives me the kicks quickly. But that doesn't work. And you've got to look at a more prolonged and protracted sort of process of giving yourself pleasure, but at the same time, keeping yourself positive.
Yeah.
I find work is pretty good that way.
Keeps you away from the vices.
Very much so. Yeah.
So any final words to support resilience amongst our really busy referrers?
I think just to keep focused on what you're doing is the main thing. In a way, being busy is the best way of dealing with this problem, because you have less time to sit and contemplate what could be an awful future. So you want to be grateful and thankful that you're busy.
For sure.
Yeah.
All right. Thank you, Dr. Poppenbeek. Appreciate your time today.
Thank you.